Well, good morning, everyone, and welcome. My name's Janice Peterson. I'm from SBS World News, and it's my great pleasure once again to be your Master of Ceremonies. Back with friends, lots of familiar faces, and lots of very talented, wonderful people to celebrate today. So I'm really looking forward to getting stuck in. This is, of course, the Multicultural Health Communication Awards 2023. Now, these awards are very special, of course. I know a lot of you have been before, and we love to champion people who are doing great work. So thank you once again for your support. But these awards are coordinated by the hardworking team at the New South Wales Multicultural Health Communication Service. So let's get this party started. We had a little bit of a taste, but I'd like to start the program with a song from our very, very special, wonderful guest performers today, the Shorat Tosan Trio from the Cultural Arts Collective. So let's make them feel welcome again.
Thank you, Janice. Shorat Tosan is a Wigger man, and he's going to sing in his language. Most of you won't understand the start of it, but it's around love, and it's about passion, and we all need a bit of that in the world. And in the chorus you'll hear the word love several times, so if you don't feel like singing it, or if you do want it, now you're warmed up, at least you can say it to yourself, because we know there's lots of communities going through a lot of bad times at the moment, so we're opening our heart to you and to them and around the world. This song's and to demonstrate what cultures were coming together from Ghana, a Muslim from China, from East Turkestan, and a Croatian import from Bankstown, what you can do if you come together in the right spirit. So it's a collaboration, what we do, and this song's called Love.
Örmelini kız yapma
Oh, thank you so much once again, and wonderful to hear that beautiful sentiment of love and compassion, and don't we need it in the world right now? So thank you so much for sharing that. We really felt the good vibrations, so we really appreciate the wonderful sounds there from Shurat to Sun Trio from the Cultural Arts Collective. And the great news is we're going to hear much more of their music right throughout the program today. So that's great news. It is wonderful, isn't it, to be here at the State Library, New South Wales, in person, in full, brilliant colour, in 3D, 4D, I don't know. But it's great to be here with you all in the same room. But hello to everyone joining us via Zoom. Great to have you joining us in the virtual world as well. So a big hello to everyone online. I'd like to begin by acknowledging the traditional custodians of this magnificent land we meet on today, the Gadigal people of the mighty Eora Nation. I pay my respects to elders past and present. Today, friends, we have some wonderful speakers lined up, including the Acting Secretary of New South Wales Health, Ms. Deborah Wilcox, who will very graciously be announcing the winners of our wonderful awards today. I'd also like to just take this opportunity to mention a little bit of housekeeping, some reminders. You know the drill. We love you having phones. We love you putting them on silent. We do want you to get engaged. Please feel free to take photos. We definitely encourage that. But please promise me this, that you will share your comments and your posts with the Multicultural Health Communication Awards team. And the hashtag is Multicultural Health Awards. And the platforms you can go to share that, you can seek out the New South Wales Multicultural Health Communication Service on social media channels. So we'd love it if you could do that. Great way to stay engaged and be connected with more of the people in this room and indeed those joining us online. We have official photographers and videographers here today. You might have noticed already taking photos, filming these awards. We're deeply appreciative of that, but please let our team know at the Multicultural Health Communication Service. Please let them know if you don't want to be videoed or filmed, if you don't want your image captured, probably best to move to the back of the room where you might feel a little bit more comfortable. Now, the toilets are located just outside this door. I can't remember, I've been there already, but feel free to use them. They're there, very easy to find through the doors there. Move towards the exit signs, pretty easy. It's now my great pleasure to call on Uncle Alan Madden from the Metropolitan It's our wonderful Uncle Alan Madden from the Metropolitan Local Aboriginal Land Council to deliver the Welcome to Country. So please join me in welcoming Uncle Alan.
Thank you. Once again, my name is Alan Madden, Gadigal Elder. For my first song, as I mentioned before, married man, still. Born and bred in Redfern, capital of Sydney. Aboriginal, black, Redfern, follow Manly. Nah, not true. Rabbitohs. And the winners are... Or we're going to wait. All right. Distinguished guests, ladies and gentlemen, it's always an honour or pleasure to welcome one and all the country. Just to give you a little bit of an insight of where you are and who we are. As with all welcomes, firstly I'd like to acknowledge our First Nations and traditional owners of the lands that you may have come from or work upon, and pay my respects to all our Aboriginal elders, all elders, past and present, also pay my respects. To all our Aboriginal and Torres Strait Islander brothers and sisters, from whatever Aboriginal or Island nation you may have come from, welcome to Gadigal. And to all our non-Indigenous brothers and sisters here today, a very warm and sincere welcome to you to Gadigal. No matter where you've come from, whether it be across the seas, across the state or across town, once again, a very warm and sincere welcome to you to Gadigal. And as I've mentioned many times before, was, is, and always will be Aboriginal land. Only three things shorter than that: coming, taxation and going. It's an honour and a pleasure to be here today to welcome one and all to Gadigal. Gadigal is one of 29 clans of the Eora Nation. The Eora Nation is bounded by nature's own, the Hawkesbury River to the north, the Peene to the west, and Georges River to the south. And in between those three mighty rivers is the Eora Nation. And in that nation there are 29 clans, and the clan's land we're on today is Gadigal. On behalf of members of the Metropolitan Local Aboriginal Land Council and of the Gadigal mob, once again, a very warm and sincere welcome to you to Gadigal. And as you travel across these traditional lands and waters, may the spirits of our ancestors guide, look over you, and keep you safe. So once again, on behalf of the Land Council and of the Gadigal mob, welcome, welcome, welcome. Thank you.
And thank you to Uncle Alan, as always, for that beautiful and always deeply moving welcome to country. And Uncle Alan always sets the tone, doesn't he? He always brings the vibe. He's a good hype man, so we love having him start these proceedings, because it's wonderful to be welcomed, and it's great to have a laugh too, isn't it? It's important to smile. So yeah, so very thankful to Uncle Alan for that very, very generous welcome to country. It's now my great pleasure to call to the stage Dr. Caroline Butler-Bowden to welcome everyone today to this beautiful New South Wales State Library event, our hosting site for the awards this morning, and has been for a little while now. The New South Wales State Library team, the New South Wales Multicultural Health Communication Service, I'm happy to say have been partners for many years now, and the State Library's been generously promoting multilingual health resources and programs across many of their libraries across our beautiful state of New South Wales. So everyone, friends, please welcome Dr. Caroline Butler-Bowden, the newly minted State Librarian for the State Library of New South Wales. Come on down.
Thank you so much. I'm really delighted to be here. Yes, I think it's week 3. I should know that, shouldn't I? And I'm really delighted to be here, and beautiful to follow Uncle Alan and his welcome to country. What a great way to begin Monday, and thanks for the performance. It was really great to hear. So yeah, welcome to the Multicultural Health Communication Awards 2023, and in particular, welcome to the State Library. It's the oldest library in the country, and we believe is the best. And it's the best because of its much of the work that we do, and at the core of that is the circulation of books in 43 languages and ESL right across this great state. And indeed, last week I was in Nambucca, and we went on the official tour, and then we went behind the scenes as well. And there was a lineup in their brand new library of books in, I think, 10, 12 languages. In Russian, in French, in all sorts of languages. And they said that a French woman who'd lived in the area hadn't read really anything in her mother tongue for many years before coming into the library. So the difference that access to books makes is obviously enormous. So 2024 is the 50th anniversary of this service, and we'll be working with local libraries to be able to mark this and celebrate and promote and indeed build on the circulation of collections as widely as possible. They've really grown steadily over the last 49 years, and as we welcome new communities in New South Wales, we strive obviously to collect books in those languages, as we know that reading in one's first language really sort of is at the bedrock of keeping people feeling connected, and is the stepping stone to literacy also in a new language. The most recent languages that we've collected, the staff here tell me, is that Tibetan earlier this year and Telugu the year before. So we continue to build it. We've been really delighted to be partners with Multicultural Health Communication Service for many years, ensuring that your authoritative community health publications in community languages are indeed available in our libraries across the state. It was particularly important, obviously, during COVID periods, but remains important every single week. And you may be interested that we're also working with Macquarie University Multilingualism Research Centre on a project to survey the availability of digital collections in community languages across New South Wales Public Libraries Network. And we hope to share those results and recommendations next year. So please stay in touch with us on Instagram, LinkedIn and so forth to see the growth of this work in this area. And good luck to all the people nominated, and I believe the people winning those special awards over there. Thank you very much.
Thank you so much, Caroline, and thanks again for the ongoing support of this great institution we're in, the State Library of New South Wales. Wonderful to have an excuse really to come here and check it out, because it's always so wonderful. And don't you walk through the doors and think, I've got to come here more often. Like it's so great and it's so inspiring, and I wonder what I could maybe learn a new thing. Maybe I'll get into architecture or something and come here for a quiet moment. Anyway, that's how my brain works when I walk through the doors here. But it is so lovely to be here. So thank you once again for being so very generous and opening your doors to us. Now, friends, it's my great pleasure to introduce Mr. Toby Wilson, a very familiar face, of course, to a lot of you here, Chief Executive, South Eastern Sydney Local Health District, and he is going to very generously officially open today's award program. So join me in welcoming Toby to the stage.
Thanks, Janice, for the welcome, and it's great to be here. Can I also thank Uncle Alan for his welcome to country and acknowledge the traditional custodians of the lands on which we all gather, the Gadigal people of the Eora Nation. They've been wonderful custodians of this land for the last 60,000 years, and I'd like to pay my respects to elders past, present and emerging. It is always my great pleasure to welcome you to the Multicultural Health Communication Awards. South East Sydney is very proud to host the Multicultural Health Communication Service as part of its services that we provide for all of New South Wales Health. And it's always wonderful to come together and celebrate these awards and reflect on what amazing work does go on around creating excellence in multicultural health communication across New South Wales Health and other health-funded non-government organisations. I'd like to acknowledge Ms. Deb Wilcox, Acting Secretary for New South Wales Health, who's going to present the winners today with their awards. And I'd also like to acknowledge Lisa, Jess and the team again for all the effort that goes into making these awards happen every year. It's a happy birthday to the awards this year. 20 years they've been running since they first started in 2003. And so it's an amazing effort to be able to continue to present these awards, and really exciting for us to get to share some of the amazing work that's going on across the state in this area. New South Wales Health is obviously committed to ensuring that those people from culturally and linguistically diverse backgrounds, particularly those people with refugee backgrounds, have equitable access to healthcare across our state, and that our services are delivered in a culturally responsive, safe and high quality way. And we know how important this is. Just last month, the Bureau for Health Information released a report that compared the experience that those people that are coming from who don't speak English at home and speak another language other than English, compared their experiences within our healthcare settings to those that spoke English. And there was some really positive news that came through from that report, that there were negligible differences for those two groups in terms of the kindness and the respect they were shown by health professionals. But there was still some opportunities to improve in that space. It was positive to see that those people that speak a language other than English at home had seen improvements in their care over the last 5 years that they received, but there was still a difference in the overall care ratings associated with those people that spoke English at home. We also noted that there are a higher percentage of people that were admitted who spoke English languages other than English at home that reported receiving contradictory information about their condition, which really highlights the need for us to continue to focus on this area and how we communicate information to people that access our care, and the importance that role that interpreters and translated information actually does provide in providing care for people that speak languages other than English. Which is why we're all here today, really to recognise the excellence in multilingual information that is provided across New South Wales Health and beyond. I'd particularly like to recognise, and it's exciting to see, that we have a new award category this year for excellence in communicating with refugees communities, which really recognises that for that particular part of our community, we need to focus in slightly different ways to reach them. We know that there are more than 35,000 refugees that have moved to New South Wales since 2015. We've come in from countries like the Ukraine, Iraq, Syria, Afghanistan, Iran, Democratic Republic of Congo and Myanmar. And they need resources and campaigns that promote access and address things in a different way, given that they've come from different backgrounds and have had different experiences with healthcare in their home countries. So it's really pleasing to see that in June this year, the Multicultural Health Communication Service launched its Developing Health Resources for People with Refugee Background Best Practice Guide for New South Wales Health staff, which provides a valuable resource for everybody working across New South Wales Health in how to plan, develop, produce and distribute information to refugee groups and to those in the community that come from have migrated to our country. I'd particularly like to thank the Health and Social Policy branch of the Ministry of Health, who have supported the development of these best practice guides through the Refugee Health Flexible Funding Pool. And again, I'd just like to congratulate Lisa and the team for their ongoing commitment to this space and the broader space around multicultural health communication and producing such high quality information for culturally and linguistically diverse communities across New South Wales. And finally, I'd like to extend my congratulations to all the finalists and the winners for today. Again, it's an amazing pool of entries that we've received for these awards, and it really does highlight the work that goes on across New South Wales Health, work that we're all incredibly proud of. So thank you, and I'll hand back to you, Janice.
Thank you so much, Toby. Always lovely to hear your very, very heartfelt sentiments and great to also celebrate 20 years of these wonderful awards and to also recognise that we have, as Toby mentioned, a brand new category. So I'm really looking forward to seeing who are the big winners there. So thanks again, Toby, for that introduction. I've managed to put in my password incorrectly so many times that my iPad has now locked up, so just bear with me for a sec. Getting back on track now. Thanks again, Toby, but I'd like to now introduce our next speaker. It's someone who leads the New South Wales Multicultural Health Communication Service team as their director, another very familiar and wonderful face that a lot of us recognise. She also has another hat, Director, Health Equity Prevention and Promotion at South Eastern Sydney Local Health District. Please put your hands together for Lisa Woodland.
Thank you very much, Janice, and thank you all for being here today. It's lovely to see you. I also would like to acknowledge the traditional custodians of the land that we're gathering on today, the Gadigal people of the Eora Nation, and extend my respects to elders past, present, and emerging. I would also like to pay my respects to people of migrant and refugee backgrounds and really acknowledge the contribution that they've made, along with our First Nations peoples, to our very rich multicultural society. I would also like to acknowledge that it is a very difficult time for many in our communities and many in our health services who are affected by conflicts overseas. And it was just so wonderful to see our performance today, which really highlighted how we can come together across shared cultures, different religions, different backgrounds, and create beautiful moments together. We know that it is very challenging and stressful, and I think it's really a call to action for us to redouble our efforts in terms of being respectful, being compassionate, and being kind to all members of communities and all our colleagues. Thank you to our special guests who have joined us here today, and a very warm welcome to Deb Wilcox, and thank you so much for presenting the awards today. Thank you also to Toby for your ongoing intense support for the service, but also for these awards. Thank you. As this audience is well aware, New South Wales is one of the most culturally diverse states in the world. More than half the people living in New South Wales were born overseas or have a parent who was born overseas, and around a third of us speak a language other than English at home. The finalists being showcased today have demonstrated consideration of the language, cultural, and health literacy needs of people from culturally and linguistically diverse backgrounds. They have co-designed resources with communities to deliver accessible and culturally responsive health information to empower communities and individuals to make informed decisions and to truly be partners in their own healthcare. To the finalists, I'd like to thank you for taking the time to submit your applications and showcasing best practice in multicultural health communication. To our judging panel, thank you for your time and your expertise in judging the applications. So we had many magnificent judges this year, many of whom are with us today. Ashley Young, Manager, Multicultural and Refugee Health, Hunter New England Local Health District. I think Ashley's with us, if you want to give us a wave. Thank you. Karina Fretwell, who's the Manager, Contingency Communications, Strategic Communications and Engagement Branch with the Ministry of Health. Thank you. Jordan Cook, who is the Senior Policy Officer for Health and Social Policy Branch, also at the Ministry, who I understand is joining us online today from Queensland. So welcome, Jordan. Hope the weather up there is a little bit nicer than here. We also had Danielle Webber, who is the Project and Volunteer Manager for the New South Wales Refugee Health Service. Hi, thanks, Danielle. Nadia Berkin, Acting National Manager for SBS in Language. Is Nadia here with us? Oh, up the back. Hi, thanks, Nadia. And Rugmini Venkatraman from member of Pink Sari and also community representative. Is Rugmini here with us? Oh, there she is. Hi. It's just so important that we have such a broad range of people that come together and help us judge these awards. So thank you very much to each and every one of you for your contributions. To our colleagues across New South Wales Health, thank you for your passion and dedication in working with culturally and linguistically diverse communities. To my team at Multicultural Health Communication Service, thank you for all your support and your tireless work behind the scenes. We're so very proud to be able to showcase the exemplary work of services and individuals across New South Wales in this year's awards. So I hope you enjoy today's event. Thank you very much.
Thank you so much, Lisa, and thanks once again to the judges, of course, and lovely to see you all here joining us, and virtually as well. Lovely to have you on board and supporting these awards, of course. We really deeply appreciate the work that you've put in, and as Lisa mentioned, a big thank you to you, Lisa, and your wonderful team, Multicultural Health Communication Service, yourself, Jess, the team. I can't name check everyone, but I do get an insight every year into just how passionate they are, how much work they put into this. You know, there's planning, there's organising, there's you know, making resources like this and the things that you find online and the pamphlets. It all takes time and considered thought. So we really deeply appreciate the work that you do, and I know that you really from your heart, don't you? You love doing this work. It means a lot, and it means a lot to us. So deep gratitude and recognition of the work that you and your team do, because it matters and it does affect people's lives. So this is serious, wonderful work. So I deeply appreciate that. Thank you once again. It's now my great pleasure to introduce our guest of honour, the Acting Secretary for New South Wales, a humble woman she is too, Ms. Deborah Wilcox. We are so honoured, Deb, to have you here today to announce our wonderful winners of the Multicultural Health Communication Awards for 2023. Please welcome our very special guest, Deb.
Thank you very much. Setting expectations a little high there, Janice. Good morning, everybody. It's my great pleasure to be here. I know Uncle Alan's gone, but he always does the most wonderful welcome to country, and I too want to acknowledge the traditional owners and pay my respects. This was, is and always will be Aboriginal land. I also want to thank the Secretary for taking 2 weeks leave so that I'm acting. And can I tell you, the past week has been 3 days, full days in the Special Commission of Inquiry giving evidence, and a half day being grilled by a Parliamentary Committee on Rural Health. So trust me, this is a highlight that I've stepped into today, very much so. Lisa, you articulated my thoughts very beautifully as I was sitting there listening to that gorgeous trio and the sentiment of love and how important it is that we all come together always. But I think if I look to the room and presumably people online, people are coming from all around the world who are so lucky to be a part of our community. All that you give and teach us and make this place just a much more beautiful and wonderful and fulfilling place to live. I thank you for making the decision to be a part of Sydney and Australia. But there is so much tragedy around the world, and I think our purpose around multicultural health and communication could never be more profoundly important. And hearing about the Refugee Award, Toby, I mean, when you think about the trauma that people have endured, the bravery to leave their home and to come to another country. Again, it's our privilege to provide these services, and it's our duty to do them the very best we can. And I thank Lisa and all of the team and all of you that work in multicultural health and equity services and health prevention, where we touch these communities. You know, it's just fantastic work, and it makes working in the public health system all the more special. Now, there's a lot of very clever people who have entered these awards, so I want to extend my sincere thanks to all of the people that submitted. As I say, not everyone's a winner, but what you can at least see from all of the applications is the amount of wonderful work that's going on across the system. And just by virtue of submitting an application and that information being shared means that hopefully other people will pick up on the ideas and the innovations and the approaches that you have to communicating with multicultural communities. I want to obviously thank Lisa and the team, and obviously Toby for your stewardship of this great service on behalf of New South Wales Health. The judging panel, difficult task, as they say, but I'm absolutely certain it would have been a difficult task, and takes up a lot of time too, and we're grateful for that you have given to enable these awards to go ahead today. they always give me things to say about frameworks, you know, culturally and linguistic diverse New South Wales Health Framework and future health and all of those things. And yes, they're mightily important. We have to give structure and governance to the system to support people going about delivering these services and providing for communities. But I guess what it comes down to, and not to be too soppy, it just comes down to humans and relationships and connecting. And I'm very pleased to be in my day job, the Deputy Secretary of the division that developed the Cultural and Linguistically Diverse Framework, and I'm also the Executive Sponsor for Future Health. And my comments by no means diminish the importance of these bodies of work. Hundreds of people have contributed, and they will set a direction for us and keep us on course. But as I said, ultimately it's human connection, and I think even just the little bit of interaction we had this morning before the formality of the events kicked off, it felt like a little bit of a mini reunion. I caught up with some old buddies, and not so old buddies, I should say, Margot, we're still very young. But, you know, hearing the music and everyone being together that is really what it all comes down to. There's also important that we arm the services with the information they need to make good decisions and to marshal the resources in the right places. And one of the things that has been provided to me in the notes here is around a report by the Australian Institute of Health and Welfare, and it looks at health outcomes, health service use and sadly causes of death for humanitarian entrants who came to our country from 2000 to 2020. And we see some pretty startling statistics: increased rates of GP attendance, high self-reported rates, diabetes, and high rates of death due to drowning and liver cancer. Not a happy story, but gives us a basis, gives us some facts and data for which we can work on to continue to improve what we do for and what we do with our multicultural communities. The introduction of the award category, Excellence in Communicating with Refugee Communities, as Toby mentioned, incredibly timely, and what a rich and diverse group of people, again, a privilege to provide care and support to. Prior to being in the ministry, I worked in Northern Sydney Local Health District, and many people might think it's not a particularly diverse community there, but we have a large Tibetan community that live up in DY that we're connected with, and I think probably we'd all agree during COVID those relationships got deeper, and I think it wasn't all good COVID, but I think if there were some good, I think that really deeply connecting with many communities was a really wonderful and lasting result of that. So I want to congratulate the finalists and obviously the winners. Thank them not only for putting in an entry for this, but just what you do all day, every day in the health system. And I'm really grateful to be a part of this. And again, I just want to say we are very privileged to work in New South Wales Health, and doubly privileged to work and care and partner with our multicultural communities across this state. So thank you very much, and thank you for having me, Janice.
Wonderful, Deb. Thank you so much for those inspiring words. And again, to get an appreciation of how much these awards means to you is really lovely. So thank you for those heartfelt words. Well, it's now time to get stuck in. It's time to present the finalists and also announce our winners. So before we start the presentation, I just want to get you familiar with how we'd love things to proceed. So the winners and finalists, we ask that you nominate no more than 2 people from your team to come on up here to the front to collect the awards. But please make your way to this side of the stage. It'll just mean that things flow better. So if you hear your name, 2 people come to the side of the stage, 2 people max, that is. Feel free to have 1 person if you wish. But that side of the stage, and that's where we can start to do the work of presenting your trophies and certificates. That'd be greatly appreciated. Our lovely photographer, Nicole, will be on hand to take the official photos, which will be made available on the Multicultural Health Communication Service website and social media platforms. So we really thank you once again for your cooperation. I'd love to start with our first category today. That is keeping people healthy, and there are 3 finalists. Skin to skin contact builds better brains. Also, multilingual children's book, The Vegetable Horse, and Keeping Mozzies Away, protecting Pacifica communities from Japanese encephalitis virus. So, let's get on and watch these videos.
Newborns benefit from skin-to-skin contact with their mothers, especially at birth. It helps boost babies' brain development. This fact is not commonly known, especially in families from culturally and linguistically diverse backgrounds. After extensive consultation with consumers and midwives, we developed resources in 7 languages to educate COLD families about the benefits of this practice. Since its launch earlier this year, the resources have been widely distributed to GPs and community nurses and used in staff education.
Fussy eating is a common challenge in early childhood. We identified a gap in our resources for children and families from new and emerging communities in Sydney Local Health District.
Our team wanted to support families by creating a resource that promotes healthy eating and to help manage fussy eating in a fun, easy and interactive way.
We produced this multilingual children's book called Riding a Vegetable Horse. The cross-cultural book was co-designed with communities throughout the entire process, from the concept stage right through to storytelling and illustrations.
It was developed for families with children aged 2 to 5 years old and is available in 6 new and emerging languages: Arabic, Bengali, Chinese, Mongolian, Nepalese and Rohingya, based on our district demographic data.
You can find this book at health and community hubs and online soon. Happy reading to all our families. The Keep Mozzies Away campaign included an aim to keep our Pacifica communities healthy and protect them from mosquito-borne diseases, such as when Japanese encephalitis virus emerged in New South Wales. We used a comprehensive, evidence-based approach to develop the messages and tailored it through concept testing to meet specific community needs. The campaign emphasised the importance of preventing mosquito bites to reduce risk and advised how Pacifica people who were at risk could get a free vaccine using various media such as in-language videos, social media, translated fact sheets, and a communications toolkit.
The campaign was a great success. A post-campaign survey showed significantly raised awareness, changed attitudes and behaviours. 48% of culturally and linguistically diverse people recalled seeing our campaign, and a staggering 81% of total people reported taking actions.
Well, congrats once again. You can see very worthy finalists and very hard to pick a winner. But I'll now hand over to Deb to announce just who the winner is.
Pass the envelope.
Yes, drum roll.
Thank you, Janice. Oh, beautiful. That's the best drum roll I've ever had. Maybe the only drum roll I've ever had, actually. Our winner of Keeping People Healthy is Keep Mozzies Away, protecting Pacifica communities from Japanese encephalitis virus, New South Wales Ministry of Health. Wonderful, and the best drum roll of all. Loved that. I'd like to now ask Southwestern Sydney Local Health District representatives for the Skin to Skin Contact Builds Better Brains project to come to the stage for your finalist certificate. Well done. Well done. We'll get a happy snap. Look.
Congratulations. It's now my pleasure to invite to the stage the Sydney Local Health District representatives for multilingual children's book, The Vegetable Horse, to come to the stage for your finalist certificate, and congratulations for trying to get fussy eaters to broaden their horizons. Well done. Thanks again, Deb and Lisa, and congrats again to our winner and the finalists, of course, in the Keeping People Healthy category. Moving on to our next award, and it is the Excellence in Communicating with Refugees Communities category, and the 4 finalists are: Make Your Voice Heard, Understanding the Community Experience of Female Genital Mutilation in New South Wales; Mental Health Awareness for People from Afghanistan; Co-Designing Resources for Syrian and Iraqi People with Disability; Coffs Harbour Hospital Expansion Younger Stories Exhibition. So once again, let's take a look at the video and get an idea of what these wonderful teams have been working on.
Female genital mutilation is a harmful practice with lasting physical and psychological effect on women and girls in some refugee communities. Currently, there's no validated tool for exploring community attitudes toward prevention and elimination. Our research developed a tool to measure social norm, not change, and assess knowledge, attitude, and motivation related to this harmful practice.
My team at Multicultural Health Services of Western Sydney Local Health District adapted UNICEF survey tools to generate key indicators for program effectiveness and communicate essential messages to affected communities to include participation by women, men, and young adults. We were able to build trusted relationships with 6 refugee communities and 2 high-risk communities. 14 bilingual community educators assessed our program materials and administered in-language surveys. We received 415 responses to empower community voices and give them a say in the change ahead.
Communities from Afghanistan have experienced significant persecution, war, and violence. Our video in Darien English explains the link between refugee mental health and trauma and outline the mental health service available. We designed the videos with the communities and engaged a bilingual Afghan media company, Huma Media, to produce this video. Thank you to our partners, New South Wales Refugee Health Service, STARTS, Khatib Hazara Association, and Accessible Diversity Service.
We developed an oral health postcard, a series of 6 videos on the NDIS, and a video for carers of people living with a disability to help them access health and disability services that the refugee community identified as areas of need.
We held co-designing a workshop with people with disability and family members from Syrian and Iraqi refugee backgrounds and service providers to develop culturally relevant resources.
The oral health postcard provides information about public dental health services in New South Wales and promotes good oral health practices.
The NDIS video provides clear information on how to access and use NDIS, and the Kira video promotes self-care and support services.
These Arabic resources have been published on social media, multicultural media, and with settlement and disability services.
Coffs Harbour is home to over 40 language groups and more than 1,600 refugees. Ensuring cultural safety for new arrival families was integral to the success of the hospital redevelopment, being an inclusive service for all community to experience healthcare.
We wanted to improve the connection of newly arrived refugees' families to the hospital with a specific focus on young people. So we worked with social workers, interpreters, and 3 local schools to develop an arts program and exhibition. Through a series of workshops, refugee students created their own artworks using the visual language of art to tell their stories.
How wonderful, and how wonderful to provide support for some of the most vulnerable people in our community, people who have had to flee persecution in their homeland, for them to come here, to feel supported, to be cocooned, to feel that they are worthy of what we consider to be our basic human rights is a wonderful thing. I'm so glad that we're celebrating people making a difference in this field. So huge congrats to our 4 finalists. You and your team should be so proud indeed of the great work that you're doing for our refugee communities. It's time to hand over to Deb, though, to announce our winner. Thank you. Drum roll, please.
The winner of Excellence in Communicating with Refugee Communities is Co-Designing Resources for Syrian Iraqi People with Disability, the New South Wales Refugee Health
So congratulations once again to that team, and we'd also like to invite the other nominees for their certificates. Are they here? Okay, so for this year, for this category, the judges unanimously decided on one nomination that they felt needed to be recognised for their work with a special award. So it's now my great pleasure to ask the Acting Secretary to please announce the Judges' Choice Award. So I'll hand it over to Deb once again.
I didn't know I was back.
So that's
the Judges' Choice.
Yes.
And I'm pleased to announce the Judges' Choice is Coffs Harbour Hospital Expansion, Youngest North Exhibition with North
Congratulations, well done.
Yeah, good on you. Lovely to see you too. Congrats. I'm 4, we've got to get a pic.
Is Michelle Greenwood in the room? Or
Michelle?
Michelle Greenwood, this is
Oh, hopefully she's online. Big shout out to Michelle.
How wonderful. Well done. And very, very warmly received too. So congrats to the Mid-North Coast Local Health District and Health Infrastructure for your award. And thank you for coming up on stage and getting your photo taken. We're really, really appreciative of that. Well done. I'd like to now request the Western Sydney Local Health District representatives for the Make Your Voice Heard, Understanding the Community Experience of Female Genital Mutilation in New South Wales project. Come to the front, please, to receive your well-deserved finalist certificates. Well done. Congratulations. It's now my pleasure to request the representatives for the mental health awareness for people from Afghanistan, also from Western Sydney Local Health District, to come to the stage, please, if you're here to collect your finalist certificates. Congrats to the team. Well done, well done. Congrats again to the winner and to all of our finalists. Of course, we salute all of you in communicating with refugee communities category and of course the Judges' Choice Award. Well done. Our next category is Transforming Patient Experience, and for this year we have 3 finalists in this category. They are Improving Patient and Carer Journey, also Easy Read Mental Health Fact Sheets, Nourishing Our Cold Heads, that's C-A-L-D, not our cold heads, but our cold head and neck and gastrointestinal cancer patients. Let's take a look at the wonderful work they've been doing.
A cancer diagnosis is devastating for many patients and their families. They often feel overwhelmed and isolated after receiving their diagnosis, especially those from culturally and linguistically diverse backgrounds. In Southwestern Sydney Local Health District, we develop an educational program to help our Arabic, Assyrian and Vietnamese-speaking cancer patients and carers to manage their stress. We also develop in-language resources to help them navigate the healthcare system and access appropriate services. We use an evaluation tool called the distress thermometer, and it showed an overall decrease of stress among participants. The menu can be modified for use with other COL communities to improve their cancer care experience.
Easy Read documents can improve access to essential information about mental health for people with intellectual disability. 3DN's lived experience researcher Talia Hines says Easy Read is important because it helps us understand what is going on. It enables us to participate and adds the ability in disability. We undertook consultations with people with intellectual disability, their families and service providers to identify and provide key health information about mental health in a culturally relevant way. We also analysed demographic data to identify Arabic, simplified Chinese and Vietnamese as key languages for the fact sheets. These in-language fact sheets have been shared widely with disability and health services in New South Wales.
We're from Northern Sydney LHD.
And we wanted to transform the experience for our culturally and linguistically diverse cancer patients
by providing culturally relevant information.
Research shows that cancer patients have poorer outcomes when they lack access to translated culturally relevant information. Our data identified 63% of non-English speaking cancer patients at the Northern Sydney Cancer Centre speak Korean, Mandarin and Cantonese.
The impact of head and neck and GI cancers can be devastating and lifelong, affecting eating and swallowing.
The translated culturally relevant recipes, self-referral pathways, nutrition and swallowing resources developed with this co-design approach can greatly help culturally and linguistically diverse cancer patients across New South Wales to improve their health outcomes.
Well, some great people doing fantastic work. Deb, it's time to get your step count up again, and Lisa, to announce our winner. Drum roll.
That's beautiful. Our 2023 winner for Transforming the Patient Experience, I have to declare a conflict of interest, Northern Sydney Local Health District, nourishing our cold, head, neck and gastrointestinal cancer patients.
congrats to the team from Northern Sydney Local Health District. And we promise this is a completely fair and rigorously independent approach. I know Deb's declared a conflict of interest, but there you go. I'd like to now ask to come to the stage our friends from the South-Western Sydney Local Health District for improving patient and carer journey. Come to the front. We'd love to salute you and give you due praise. It's now my great pleasure to ask to come to the stage representatives from the New South Wales Ministry of Health and the Department of Developmental Disability, Neuropsychiatry, University of New South Wales, to come to the front to receive your well-deserved finalist certificate for the Easy Read Mental Health Fact Sheets. Congratulations again to our wonderful winners and finalists. Well done. It's now time to move on to the individual awards. So the next category is Staff Member of the Year. The two finalists are Dr. Marguerite Tracy and Sumitra Joseph. So let's take a look at these videos to find out a little bit more about our finalists and their wonderful work.
My name is Marguerite Tracy and I'm the Research Team Lead of Drug Health Services at Western Sydney Local Health District.
So Dr. Tracy is an addiction medicine specialist and general practitioner who empowers consumers from cold backgrounds to advocate for their own healthcare and also be involved in decision making. Dr. Tracy manages the research team and empowers patients every day. She helps improve communication between the public health system and general practitioners to enable access to healthcare for vulnerable populations, particularly in Western Sydney, with 54.3% of residents speaking a language other than English at home. She examines communication in healthcare and has undertaken evaluation into resources available for consumers, including the Choosing Wisely Australia 5 questions. That's an online resource for clinicians to support communication with patients from refugee and asylum seeker backgrounds. So a huge congrats to Dr. Tracy.
I'm Sumitra Joseph. I'm the Operations Manager for Perinatal, Child and Youth Mental Health Services at Western Sydney Local Health District. My job includes providing mental health support for multicultural communities in Western Sydney. I feel blessed to serve the community in Western Sydney because it is the most culturally diverse and vibrant suburb in Sydney with many vulnerable people. I know that mental health is a difficult topic for many people, including mothers, children, and young people. For over 40 years of work in this space, I've realized that mental health is very often ignored. I want to make a difference and make a change, even if it's a small one.
So how amazing are our finalists for Staff Member of the Year, Sumitra and Marguerite. Congratulations once again. Deb, it's your turn to do the honours and announce our winner.
The 2023 Staff Member of the Year goes to Sumitra Joseph, Western Sydney Local Health District. Thank you. Western Sydney Local Health District.
Well done. Well done, Sumitra. What an achievement. And 40 years, another round of applause. What an achievement. So wonderful. Could I now ask Dr. Margaret Tracy to please come to the stage to receive your well-deserved finalist certificate? And can I apologise for the sticky bits of stuff on the seat that are attacking all of our finalists and winners? Well done, Dr. Tracy. Very well deserved. Thank you so much. Well, friends, our final category for the 2023 Multicultural Health Communication Awards is the Consumer Community Representative of the Year. And our two finalists are Georgette Hilmi and Nagla Suro. And here are the videos to showcase the work of these two wonderful finalists.
My name is Georgette Helmi. I am a bilingual community educator at Western Sydney Local Health District. I support the delivery of BCE program, and I work with women, men, and young people from migrants and refugees background to improve their understanding of health and increase their access to health service.
Georgette is a legend. Her work over the past 25 years has been pivotal for the bilingual community education program. She does everything with full heart and full smile. She has improved health outcomes for more than 10,000 community members from culturally and linguistically diverse backgrounds. She does her work respectfully and responsibly and has contributed to the health system and to the positive health of our communities.
Nagla is the Consumer Ambassador at Auburn Hospital and is a founding member of our Consumer Partnership Committee. Nagla has been instrumental in improvements to the hospital, such as the new palliative care unit, which opened this year. She's also done hundreds of patient surveys during What Matters to You Day, and as well as just doing patient rounds in both English and Arabic, which meant that we got better feedback from people that otherwise would not be able to give us feedback about what they need.
I believe everybody should be treated with kindness, dignity, and respect. Helping others is not a chore to me, it's a passion and an honour. I feel most rewarded that I am able to give a voice to those who may not have one because of many factors, such as language barriers, lack of knowledge of the Australian healthcare system.
Goodness gracious, two health titans going head to head. Oh, we love to see a battle, but who will prevail? Drum roll, please.
Thank you very much. Our Consumer Community Member of the Year 2023 is Georgette Hilmi, and just hold your applause, and Nagla Suro. I just said, can't we give two? And I crossed my heart, I hadn't even read the line. Come forward and get the picture. You may as well go together. Come forward, come forward. How wonderful. Congratulations.
you wanted to bail up our winners, you're more than welcome. You have my permission. I'm sure they'd love to tell you about their wonderful work that they're doing. Thank you so much to our wonderful and well-deserved winners. A big round of applause once again. Yes, well done once again to Georgette and Nagla. Such an honour to have you both here, and so wonderful to recognise the wonderful work that you do. So huge congrats there for the Consumer Community Representative of the Year category. And we also have to acknowledge the Western Sydney Local Health District for nominating you for this award. So well done. Well, it's been an incredible lineup of winners and finalists. I want to thank everyone for the wonderful work that you've done in contributing to the healthcare and well-being of all of us in our wonderful state of New South Wales, but particularly for our multicultural community. So thank you so much for your hand in that. It's now time to acknowledge the incredible work and commitment by our very impressive and esteemed panel of judges for the 2023 Multicultural Health Communication Awards. They, of course, had the tremendous and big task of culling all the applications, identifying the finalists, and then finally choosing our winners. So I'd like to call the judges to the stage. Let's have a good sticky beak at you this time and receive your certificates of appreciation from Deb and Lisa. Ashley Young, Manager of Multicultural and Refugee. Oh, there you go. Thank you. Ashley is the Manager, Multicultural and Refugee Health, New South Wales Health Service, Hunter, New England Local Health District. Ashley does tremendous work. I've worked alongside Ashley in another capacity, so congratulations to Ashley and the team. Katrina Fredwell, Manager, Contingency Communications, Strategic Communications and Engagement Branch. Well done. Karina. Jordan Cook, who is joining us online, we hope. G'day, Jordan, if you're there. We're sorry you couldn't be in the room with us, but we are saluting you, sending you our big thanks. Jordan is a Senior Policy Officer, Health and Social Policy Branch, New South Wales Ministry of Health. We also have Danielle Webber, Project and Volunteer Manager, New South Wales Refugee Health Service. Well done, Danielle.
Congratulations. We'll get a little pick at the end. We'll get everything. Oh, thanks.
Nadia Bakarian, Acting National Manager of the best broadcaster in the land, SBS. Well done, Nadia. Rugmini Venkatraman from the Community Representative and member of Pink Sari, who we love. Well done, Rugmini. And Toby, before you get too comfortable, we'd love you to be in the photo as well. Thanks to our wonderful judges for their work in joining today's celebration and doing that hard work of choosing our finalists and our winners. Thank you so much again for being here. We love recognising your work, so deep appreciation from us. I'd like to now ask Deb, get those step counts up. Come on, Deb. Would you like to... Well, before you said you wanted to, take over from emceeing.
Yeah, I know, but
so,
the band was so good
Yeah,
too,
that's right. So here's your little opportunity just
Thank
to give
you.
us some closing remarks.
Lovely.
Thanks, Deb.
Thanks very much, Janice. What a beautiful morning it has been, just incredibly uplifting. And as I said at the outset, it's just a privilege to work in health and a privilege to, to hear and all the stories and all of the great work that's going on out in the system. But as I said, it's also just about the humanity, and isn't it beautiful the way people come together? And when I look at those two beautiful community members who have given so many years of service, it just, words fail me. So thank you very much. Thank you. So enjoy the rest of the day, and again, thank you, Toby and the team. Thank you for including me. I've thoroughly enjoyed it. Thanks a lot.
Thank you so much, Deb, for those wonderful and generous words. We know how much this means to you. You've been so great in handing out the awards, and to Lisa as well. Thank you for recognising our wonderful, talented people in the room here today. It's been an honour to be your MC. It's been an honour to have our special guests with us today as well. So congrats again to all the winners, to the finalists, for your passion, for your dedication. It is so very deeply appreciated. We also want to congratulate the individuals and organisations who took the time and effort to submit applications today for the awards. And we want to thank Deb for presenting the winners and their trophies, to Toby and Lisa, of course, to Caroline, Uncle Alan, of course. Remember at the beginning of the ceremony how generous he was with his words. So thanks again to everyone for being with us today. All the videos you've seen this morning, the recording of these awards, will be available for download by visiting the Multicultural Health Communication Service website. That is mhcs.health.newsouthwales.gov.au. I'm sure anyone from the team can point you in the right direction for those resources. The links will be shared on the MHCS website and social media channels, so keep an eye out for that. We also invite you to please like the Multicultural Health Communication Service social media channel. Come on, you've already done that. Surely you've done that. But we'd love you to give that a like, give it your support. And the hashtag, of course, hashtag Multicultural Health Awards. If you're posting anything, that's a great way for us to all keep engaged. The New South Wales Multicultural Health Communication Service would like to thank the Office of the Minister for Health, the Office of the Secretary, New South Wales Health, the New South Wales Ministry of Health teams, also a special mention to the Health and Social Policy Branch and the Strategic Communication and Engagement Branch, and the Multicultural Health Services right across all the local health districts for their continuous support of the Multicultural Health Communication Awards. We really appreciate your time and efforts as always. A big thanks to everyone who's joined us in the room here today at the New South Wales State Library. Many, many thanks to you, and for those friends online, hello, and thanks again for joining us, for being part of this very special event. I'd like to, on that note, extend a huge thank you to the team from the New South Wales Multicultural Health Communication Service for their ongoing exemplary work in showcasing the outstanding multicultural health resources, innovative programs and extraordinary initiatives that address the health needs of our culturally and linguistically diverse communities here in our beautiful state of New South Wales. For all our speakers, winners, finalists, I want to ask you to stay behind. We love taking photos. We need to capture this day. We need to snap away. So please stick around for some group photos. And for the rest of our guests, I'd love to invite you to head to the Macquarie Room. That's just next door, I'm told, for refreshments, a bit of networking, a bit of chit-chat before we dive into the week ahead. My name's Janice Peterson. I'm from SBS World News, and thank you so much for being such a wonderful audience. It's always a great pleasure to be here to salute our wonderful team at Multicultural Health Communication Service and for the incredible work that each and every one of you does. So thank you so much. But I want to leave you with the colourful sounds of the Cultural Art Collective. That's a group that shares a similar vision with us here today to create exciting, inclusive initiatives that showcase diversity. But I think Deb has something else to add.
I told you, I'm a little bit bossy. Okay. I just wanted to thank Janice for adding such beautiful gravitas and warmth to this event. We thank you very, very much.
Pleasure, Deb. Yeah. Pleasure. My absolute pleasure. Look, I feel like I'm part of the family here and part of the furniture, quite frankly. So it's my great pleasure. But everyone, have such a wonderful, wonderful day and week. Let's dance.
Yeah, Dickie, come on. Ümit üzmüdüm senden, ümit üzmüdüm